Dr. James Yoder here, on-site PT. We're talking about pelvic obliquity, and then people that have a pelvic rotation. These are going to be people that have typically one-sided low back pain, very localized. Sometimes it will creep down into the glute. Sometimes they'll get some referral, but usually they say it's right here over this bony prominence. Sometimes they'll get some spasm up into the back, but the sharp pain will be localized on one side. You probably have a hypermobile pelvis, and one side's probably a little more forward than the other. The problem with this is, and it's very common, we get patients that say that they have a leg length discrepancy, or they say they have a very significant scoliosis. Now, they may still have a scoliotic thing, but a lot of times people that have a mild scoliosis or a mild leg length, their leg isn't truly longer. There's an issue in the pelvis, a positional thing going on that's causing a rotation up in the spine or a leg length discrepancy. If we take a look here, what we see is if this is neutral, if my right side comes a little forward, you can see how things kind of can look off if I'm a little rotated one way or the other. And then my spine rotates too. My left side's a little anterior tilted, my spine's going to rotate right. I compress that enough in a bad position, I'm going to start to have a lot of problems in the low back. So a way to assess this, if you feel like, hey, I have low back pain in that area, it's one-sided, or even if it's not, this is a good thing to kind of self-screen, and then you can do the treatment right away. So I like to start on the stomach here, okay? And you're going to put one hand on one side of your pelvis on the back. There's this bony prominence here called your PSIS. And then on the other side, and I'll show you over here, the front of the pelvis, another bony prominence. So let's say on the left we're in the back side of the pelvis, and then on the right we're on the front. And I'm just trying to take a deep breath in, exhale, and push into my hand. So on the left, I'm trying to push my pelvis back, and on the right, I'm trying to push forward. I don't want to move my hips a bunch, okay? It's just a small little pelvic movement, okay? Hold the position, push into your hands, okay, and then relax. Take a couple breaths while you're in that position, and then on the other side, okay? So as I'm laying there, I'm putting one hand here on the back, and I'm trying to push my pelvis into those positions, okay? Now, what will you feel? If you're having one-sided pain, what you'll feel is, when you do it the right direction that's correcting your pelvic obliquity, you'll feel release. You'll feel a muscle tone, muscle spasm loosen up. It'll feel a lot better. And then the other direction, it may hurt a little bit. It may be uncomfortable, feel a little bit of a sharp pain, reproduce your pain. Then you're probably pushing into the bad position, okay? So what you'd want to do is, if you're getting that release, or if you feel like you can't really move very good into one direction, you'd want to keep doing that and kind of do some muscle energy on yourself, pushing into that position, strengthening yourself into that pelvic position to try and get some rotation, okay? The next thing you can do, if you find that, say I got on my stomach, and when I pushed my left side of my pelvis forward and the right side backward, it felt good. It felt like a release. It's like, oh yeah, if that feels better. You can do a muscle energy technique using a towel that's pretty effective, okay? So you're going to lay like this in this 90-90 position, hips up, knees straight. And let's say when my right side of my pelvis goes backward, it feels good, and when my left side goes forward, it feels good. It releases my pain. So I'm going to want to drive this leg up and forward and this one down, okay, to correct. Again, if you're confused about this and you don't have a therapist to ask you, just try both sides and see which one feels better, okay? And one side, if you do in fact have this problem, one side will feel a release. It'll feel much better. It'll feel like something that needs to happen, okay? So I'm going to pull this up and this side down. And I'm just going to take a deep breath in, exhale, and push hard into this band, almost as hard as I can, and relax. And I want to get this band kind of up to the top of my hips as much. I don't want it to be down by my knees. And I'm really trying to start the movement through my pelvis and core. Okay, deep breath in, exhale. Okay, and then relax. Okay, you can try both sides. This is a way to do a self-muscle energy technique to correct a pelvic obliquity. Okay, give it a try, see how it feels, and see if it helps you.